You have rights as a patient. Did you know that? But here is the big problem. Reality is most people don't know what those rights are. And no one's going to explain them to you in the moment. Yes, the hospitals will provide you a copy of your patient's rights, but will they take the time needed to explain it to you in language you understand? I think you already know the answer to that question.
Welcome to the walkthrough.
Welcome to the walkthrough, where we empower, inform, and provide clarity on your journey to self-advocacy for you and your loved ones in the medical world. If this channel has helped you, please hit the like button below and subscribe to our channel. So let's paint this picture. When you're in the hospital, when you're in a doctor's office, it's easy to feel like you have to just go along with whatever's happening. You go along to get along, but you don't. And knowing your rights can completely change your experience and your outcomes. So let's clarify some things and myths as it pertains to what's often called the Patient Bill of Rights. First myth, there is no such thing as a federal law in the United States entitled the Patient Bill of Rights. So let me give you some history. In 1973, the American Hospital Association, known as the AHA, adopted the first official Patient Bill of Rights. In 2003, this was replaced by the Patient Care Partnership, which is a brochure which is given to hospital patients outlining what to expect during their stay. As there is no federal law, many states have adopted their own mandated Patient Bill of Rights, which offer more protections. Now let's discuss some of those rights you will see in the Patient Care Partnership, as well as most state laws. So let's look at right number one. You have the right to ask questions. You have the right to ask questions until you understand. Not just a quick explanation, real understanding. If something isn't clear, say, "Can you explain that in a different way?" You are not expected to understand medical language because you're not a doctor and you're not a medical professional. Right number two, you have the right to refuse treatment. You have the right to say no, even if a doctor recommends something. Now, this doesn't mean you should refuse care lightly, but you have the right to pause, ask questions, and make a decision. Right number three, you have the right to access your medical records. You have the right to your medical records, which includes test results, notes, diagnoses, and you can request them, and you should. Number four, your information is protected under HIPAA. HIPAA is an acronym for the Health Insurance Portability and Accountability Act of 1996. It's a federal U.S. law designed to protect sensitive patient health information from disclosure without your consent. It mandates privacy and security measures for safeguarding medical records, and it ensures health insurance portability and reduces healthcare fraud. So let me put it in simpler terms. HIPAA means your personal private data cannot be shared without your permission. Number five, you have a right to a second opinion. You have the right to get another opinion. You don't need approval. You don't need permission. And in many cases, it's the smartest thing you can do. So why should this matter to you? Well, think about it. When you don't know your rights, you tend to go along with things you don't fully understand. I know I have. And when you do know your rights, you participate. That's important to understand. And understand this also, you're not being difficult. You are being informed. And that changes everything. The best patient is an informed patient. Now save this video. You'll want it later. At the walkthrough, we're here to empower, inform, and provide clarity to you. If this video has helped you, we would like to know. Please leave a comment for us below on what you were able to take away from this video. And if there's any other topic you would like for us to discuss related to your self-advocacy for your healthcare, let us know in the comments below. Finally, please hit the like button and subscribe to our channel if this has helped you in any way. We love you. We're praying for you. Blessings.